In order for you to work in a healthcare setting, yeah, working as a healthcare assistant, working as a support worker, working as a mental health assistant, working as a, a doctor, nurse, working with the children, with the elderly, with everyone, depending on which career path you choose to go to. First of all, what you need is a clean DBS. Yeah, you need a clean DBS. DBS is a database background check, which is done on everyone applying to work in a healthcare setting. But I've realized that it's not only done in healthcare setting, but lots of companies actually do background checks right now because they want to feel that they want to make sure they're hiring the right person who will not harm the business or those around them. So making sure you have a clean DBS, a clean DBS is actually really good because if your DBS is a red flag, then that can lower your chances of you getting work because most companies don't want to hire somebody who has all this criminal background, blah, 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 because when you go to venture working in a healthcare setting, you're going to be healthcare setting is a working healthcare setting or healthcare setting is a very sensitive environment. Yeah, it's demanding, it can be depressing, but then it's very sensitive and it needs somebody who is actually right for the job. Yeah, who can do the job and who's right for the job, and it will not cause damage to those around them and those they're looking after. So having a clean DBS, it's very, very important. That one you definitely need it. I always suggest having one online, saved online, which is what I do. Because when you have one saved online, it not only saves you money, but also it saves you time. You only have to renew it once a year and you pay just £9. But if you don't have one online, then you have to do one every time you apply for a company and you have to pay maybe £60, I think, or £20. I think they've reduced it now, £20, £30. Yeah, but still, it's better to have it online. It's much safer, yeah. Another thing you need or you might need, some companies don't ask for, but some companies do, is qualification, NVQ in healthcare setting, level 1, level 2, level 3. Yeah, a pass, merit, distinction. Distinction is always good, merit is always good. When I did my healthcare level 3, I got distinctions. I was excited. So I did level 1, I did level 2 because I did my GCSEs. When I finished my GCSE, I wanted to do nursing. I wanted to venture into mental nursing because that's what I liked. So in order for me to do this, I said I have to go. I decided to go to college and do health NVQ in healthcare setting. So I did level 1, level 2, and level 3, which I finished and I passed. Yeah. So so most of the companies, they won't ask you for that, but they encourage you to actually have it. If you don't have this information, again, most of the companies, they will offer you they will give you some, they will educate you through your as you work. While you work, they also give you classes, they offer you classes, they teach you throughout it until you finish, then they give you a certificate. Yeah, they can just send you to school, which is good. They do that here, which is really, really good. So you get your work, you get your money, but still again you get your education. So that's why it's good to have the have your have some qualification, have some whatever you do, have some qualification at least, yeah. And another thing is work experience. Now, most of the companies, they won't ask for this work experience, but again, lots of companies ask for it, especially if you're going to be applying permanent. I've realized most of the companies who ask for this are companies that are going to hire you to work permanently. They're going to have you as a permanent staff working on a rota or working as a part-time, but you're part of the company compared to somebody who's not on a rota, who's not a permanent staff. So basically, you can choose to work permanent, whereby you're on a rota, yeah, and you can choose to work with an agency, whereby you choose when you want to work. You want to work Monday, you say, oh, next Monday I'm not working. Oh, I can work Wednesday. Oh, I'm not going to work, which is what I prefer. So most of the time, when you choose to apply for these companies permanently, they're going to ask for work experience. I've realized they do. Yeah, they will ask for 6 months. Right now they're demanding for 6 months at work experience at least. But again, some companies are not asking for that because they know that when you go in, they will give you some. You will gain some experience. You will learn, and they will give you some training. But if you don't, if you go to a company which asks you to do that, but you actually don't have to give them, they ask you for work experience but you don't have it, you can easily just go apply for another company that doesn't need work experience, get those work experience for that period of time, and then apply for another company. Another thing is training. Yeah, most of them will ask you, you go training, but obviously they will offer you training. It's very important, obviously, to have the training, right training, up-to-date training. Your training are always renewed every year. They renew it every year. Whenever it goes off, they ask you to redo them. They can ask you to attend face-to-face training, or you can do them online. If you're working permanent again, it's very, very, very hard. If you're working permanent, you're gonna probably do training every other week. I've seen some people work permanent and they're constantly doing training every other time. I remember when I applied to this company and I was on rota because I was like a bank staff. And I was doing training every other week, despite the fact that before I joined the company, we had a 1 week training of every day from morning to evening until even at night. And we had homework being given to us. So that stressed me, and I had to leave, to give up working at that company, because at that point I was also in university. I was trying to balance university work and trying to balance training every week. Now, if you work permanently for a company, they will bomb you with training. They will be putting you into training every week. That's what I've seen they do. Every other time they'll be training, training, training. But again, it depends, yeah. But if you work for an agency which pays you every week, they renew your training only once a year. So that's much better. So that's what I prefer. Once a year, I get my training renewed. That's what I prefer. Now, most of the companies, again, they won't ask for this. They won't say we need training, blah blah blah, because they will always give you training, which can be free, or sometimes they can take the money off your wages once they start paying you. I remember when I came from Africa and I moved to UK just after living here. I've been here for years now, but when I moved and came here, I just finished high school. No, I just finished primary school, primary school, and I was just on my first year of high school, Form 1. And when I came here, obviously, I had no work experience. I had no whatever. But after 3 years, I was able to apply and start working, because here you can start working at a young age. I started working and I was making money already. So even if you don't have experience, you don't have all those training and all that stuff, you can still be able to work, make ends meet, and be able to pay your bills and do everything that you need. Now, you can always work, yeah, with as I said, applying permanent, working permanently, yeah, and getting paid every month. Now, when you apply to work permanent, it has some benefit, but I'm not a fan of working permanent because I like my freedom. Yeah, it has good and bad side. Working permanent is good because you guarantee your hours. Yeah, you guarantee your hours that you're gonna get 37 hours every week, or if you wanna do extra more, you can always do more. Yeah, but you are constantly on rota and you get your 37 hours every week. That's guaranteed hours. Yeah, and you get your leave. Yeah, and you get paid leave. And you get sick pay, and you get holiday as well. But I think you get 2 weeks only of it per, I don't know how it works, whatever. Yeah, so you have a bit of opportunities and all that stuff, but disadvantage of it is that you have to be on the rota every other week. Every other week you're going to be on a rota, Monday to Friday, or whatever, Monday to Wednesday. If you're doing long days, if you're doing half days, probably Monday to Friday. Now that's not what I like. And I don't like the fact that you get few holidays a week, 2 weeks, rather. I don't like that. Yeah. So me, I chose to go to working for an agency which allows me to choose my hours. Yeah. So I choose when I want to work. I can choose to work Monday, Tuesday, and Saturday this week, and I say, next week I'm actually not available to work, so no, I'm not working. Then the other week I can say, actually I can work Tuesday and Sunday, and you get paid every week. Yeah, you get your money coming every week. Every Friday your money comes in. Every Friday your money comes in. Everybody likes to be paid on a Friday. So even if you're working permanently, you can still choose to apply to another agency, another company that's paying weekly. So you have a monthly pay and a weekly pay. While you wait for your monthly pay, you have your weekly pay. Yeah, a lot of people like to do that, which is good. Why? Because sometimes you need quick money, and that's what I like in healthcare setting, because you can work back to back. Yeah, you can easily just work back to back. When you have a weekly company, you can also have as many. You can even have 5 if you want to, as long as you know you're going to be able to work for this company. They won't be happy if you can't work for them. When they call you and they say, can you work today, can you work tomorrow, can you work tomorrow, and you can't do it, they won't be happy, and they'll probably stop offering you work. So I think the best just go for 2 or 3 companies. 2 to 3 companies is probably enough, because when you have one, sometimes they might not give you work every time. But if they're not giving you work, if you have 2, then you can easily work for another one. But your money comes in every week. That's what I like. And you have the time to go your holiday, even 5 months if you want to, because you are not on contract. When you come back, you tell them, look, I'm back now and I'm available to work. Okay, now I'm going on holiday, I won't be here and I won't be available to work. That's what I like, because that's what I've been doing for many, many years. And that's how I've been paying, everything, because I was a student as well, and I was studying, and I still wanted to make money. Yeah, I was in college, yeah, and I still wanted to make money, and I was living at home. So I said, you know what, this is gonna be a good job. I can just work whenever I want to and still make money and go to school. Yeah, and that's what I've been doing, because I like to travel. So a lot of time I will travel and go back to Kenya for 2 months, 1 month, weeks, 6 weeks, 8 weeks. If I'm working permanent, I can't do that every time. I can't do that. I don't have that choice. So this allows me to, work whenever and, take off whenever I feel like. I'm not on any contract. I don't like to be tied up on any contract. Yeah. This job, it's really, really, really good. Yeah. You can't be like, you don't have a work, because there are always so many opportunities. You can easily lose one today and say, look, I'm going to apply for this, and you quickly, you apply, and before you know, it won't be long, you start working. Yeah, it's a good job to make quick money. Yeah, lots of people who are students, who are trying to get experience, are caught up in the setting, working and trying to make ends meet, but then also getting experience. Those who have retired, those who are just trying to make extra money, I personally really like it, and I think it's a really, really, really good. NHS, which is a big government hospital. Lots of people go to work for NHS to expand their career path as well. I wanted to go for NHS, so I can expand my career path. But because of COVID, I just took a bit of break. Though I have some few friends who are working in a NHS, yeah. And even if you don't have qualification, if you don't have education, you have no education, you still have hopes of progressing in your career, yeah, gaining skills and climbing up on the ladder, yeah. And as you go, your pay also increases, which is really good. You get your pay every time. This is not Africa, whereby sometimes you work and you don't get paid. Obviously, there's some companies here that you might work for which are like that. They're like dodgy companies. You work for them. There are lots of them. Yeah, there's some of them, because lots of people are trying to open a company in healthcare setting and trying to hire and all that stuff, but some of them can't run those companies, and they will hire you, and and you start working and you don't get paid. But that's less likely, but it depends who you choose to work for. There are some people I don't work for. Yeah, so you have to make sure you're working for the right person who's going to pay you. So with NHS, you get competitive pay, which is really good. You get personal development and a career progression, which is really good. Your skills, you expand into your skills. as you grow, even if you don't have qualification, you don't have no skills, you know, there is so much to learn. There is so much to learn. And at the end of it, they give you that certificate. Yeah. So most of people choose to go into this setting. Lots of people choose to go into this setting because they want to expand their career. You know, most of people want to work as a nurse, as a doctor in future. So they go in so they can expand their understanding, their skills in order to allow them to be able to easily branch into their career path. Because most of the time when you go to apply for a company, they looking for experience. They want to see, have you had experience? Have you worked in this place? Have you worked here? What experience have you gained? Because they want to make sure, even though they're going to give you training, but still you need to have some kind of understanding about the job, about what is expected of you, and about what you're going to do. You need to at least have a vision of what you're going to do. You can just go. Working healthcare setting is very, very demanding. It can be so stressful. It's not easy. Very not easy. So before you go in there, it's not for everyone. Some people can't do it. Before you go in there, you need to make sure that you actually know, you know, what to expect. You have to have a heart because you're going to be caring for somebody who needs you, who depends on you. So you have to have a heart. If you go there and you know you're like, ooh, what is this? I didn't expect to do this. Da, 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 da. Obviously, there's sometimes you might do things beyond what's in your job requirement. But if you're not comfortable, you say, look, yeah, this is not on my job description, so I'm not doing this. But there are some things which are on the job description which might not be so pleasant to deal with. So it's just, as I said, it's not for everyone, but you need a heart to do it. So yeah.